Psychosis often has to do with a break from reality, and that somebody who's experiencing psychosis might have very odd or bizarre behavior. They might have speech that appears to be bizarre. They also might have extreme paranoia. They could also have difficulty engaging in daily activities like work or personal hygiene. So that's something that people with psychosis might experience. And they also might experience some symptoms, like for instance, visual hallucinations, seeing things that other people can't see, or hearing things that other people can't hear as well. Somebody who has psychosis is coming to our hospital in an extremely vulnerable place. They are coming to us when they're scared, when they might be frightened or feel threatened. And I'm glad to work at a place where we have caring staff who can respond to that in a therapeutic way. Psychosis is treated at Salt Lake Behavioral Health with a thorough assessment. We want to know what this person's background is. Is there a trigger? Also, what treatment have they gotten before that might have worked for them or didn't work for them before? So one of the things that we do at this hospital is we might do a medication review and see what medications will work and which ones haven't worked in the past. We also want to do some things therapeutically. So for instance, we might do some reality testing, and where we might want to pay attention to what beliefs are coming up that might be unhelpful to this person, and how can we challenge that in a therapeutic way. We also want to look at what kind of social support they have. And we also want to involve families in their treatment so that we can provide education and so that they're able to tell their families what they can do to support them. So one of the priorities at this hospital is safety. So we want to make sure that people don't just feel physically safe, but emotionally safe at the hospital. And so, that might look like having an extra pair of eyes on someone if we think that, they might be triggered or might have an outburst. And so we want to pay attention to them and just notice how they are throughout the day. So one of the things that we offer at this hospital is expressive therapy. So often there are projects that clients can work on, and sometimes it can be helpful with a client to take a more artistic direction and have them express something that maybe words can't quite describe. And it's been very exciting to see some of the projects that they've completed on the unit. People that leave our hospital, it's very possible for them to live happy and fulfilling lives. What we've seen family members reconnect with one another, and we've seen people rebuild their lives in a different way that will work better for them.